Well, a new report says Ohioans are paying more money for health care, but not receiving health outcomes that match what they spend. NBC4's Brett Mills spoke with a policy analyst about what this means for the state. Brett?
Yeah, that's right, Jen. This report from the Health Policy Institute of Ohio shows where the state stands in terms of overall health value. And the person I spoke with shared what the impacts of those findings are and how we can make them better.
We know that increased financial insecurity can lead to really poor health outcomes and the development of mental health conditions. So that's a big concern. You could also see people dropping their insurance because they feel like they can't pay the premiums anymore.
According to the report, healthcare costs take about 10% of the income for more than 2 million Ohio families. It also shows that we are in the lower percentile for inpatient hospital expenses per day and Medicare spending per beneficiary, which can lead to more people avoiding the doctor.
When people avoid care because they can't afford it, we're then more likely to see even worse health outcomes down the road as more severe disease develops. And that's also more expensive to treat, which means potentially even bigger medical bills for families down the road.
Back in 2023, 1 in 5 Ohioans admitted to having a difficult time keeping up with paying their medical bills during the year, preventing families from reaching their full health potential. But there are tools to improve the state's health ranking. Experts suggest investments in enhancing access to mental health care, increasing price transparency, or limiting how much healthcare entities can charge for certain services.
If there aren't any changes, I think what we'll continue to see is it's just going to continue to eat a bigger proportion of the budgets of Ohio families, which when you already think about how many people are kind of right on that line of being able to afford food and housing and potentially childcare if you have young children, just can, again, like I'd mentioned before, make people have to, decide between two different, living necessities.
Now, one positive aspect of the report is that Ohio does have better rankings when it comes to access to health care than other states. Local for you, I'm Brett Mills, NBC4.
Brett, thank you. According to Forbes, Ohio's average cost for health insurance is more than $500 a month. That puts the state next to Arizona, Hawaii, Michigan, North Dakota, and Tennessee. The state with the highest average cost is West Virginia at more than $1,000 a month. And the state with the cheapest health insurance is New Hampshire at just under $400 a month. Thanks for watching. For more NBC4, download the NBC4 streaming app. You'll get free 24/7 local programming streamed straight to your living room. Just search NBC4 Columbus on your Apple TV, Amazon Fire, Roku, or Samsung device.